Hello, my name is Amy Sturkey. I'm a pediatric physical therapist, and I'm here in a moment with my co-instructor Bode, who is 7 months old, and he does not have torticollis, but we're talking about torticollis. And I am talking today about total motion release, which is a systematic approach to look at how there are restrictions in the body and how to treat it. And their whole philosophy is if you have a side that's tight, that you shorten it to try to get it to relax, to be able to stretch it out better. So that is just really counterintuitive to most physical therapists. Most therapists, if they think, oh, I have a tight hamstring, I need to stretch it. But they actually do the opposite with these motions that they have. So if you think about a knot, you can, if you want to get that knot out, if you pull it tight, you make that knot worse. If you shorten that knot, you lengthen it so it can then relax and you can get the range you need. So tighten it, it gets worse. You shorten it, and that knot gets loose. So we're going to do, this is the third in a series of 4 videos about total motion release. We've already done 2 of the motions. We did the upper side bend, the upper twist, and now we're going to do the lower side bend. You can do that on the back and the stomach. So let's bring in Bode. All right, so Bode does not have torticollis, but if he did, if he had a left torticollis, he would be shortened on his neck over here and rotating his head to the right, but also this shoulder would be tight and this side would be tight. So if I was doing the lower side bend, I would expect that this side, when I do the lower side bend, you bring up the hip on this side, you bring up the hips on that side. I would expect him to go really far this way and hardly want to go the other way at all. A long way and hardly. Let's see what he really does. It looks like, actually he wants to go up this side really well and doesn't really want to go that side. So he's being a great actor. So if you wanted to treat that, if you found a kid did not want to lengthen one side, then what you do is you shorten that side. I know. You shorten that side and you hold it for a little bit. Hi, how are you? You doing good? And after you hold that side, then you take it to the other side. Still doesn't want to go as far. Hold it some more. And try it again. Now, for him, I'm still seeing a difference in the sides. You just want to hold it longer and longer than I probably want to hold for this video. And you just keep trying, holding the side that's easy. You hold it short, so then you can try to stretch it out to the other side. You can do this on your back, but you can also do this on your belly. I don't know if you're going to think this is rude, but we're going to flip on over. And you can try the same thing, taking them up one side, taking them up the other side, seeing which side is tighter and which one is looser. And the side that is tight, you shorten that side. So he's going up this high over here, not as far this way, this high. So I go to the easy side and hold it to see if the other side will go easier. So that's the basic technique. I hope this is an easy idea that you can do at home with your child. Whichever side is the tighter side, you shorten that side. I know it's counterintuitive, but that's what you do. And then you take them to the other side and see if it got easier. And you keep doing it until they come out even on both sides. I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.